removed it before.
So, hello everyone, this is Pragyan. We have started these sessions, these are free sessions, and in this, our two students who have done courses with us and who are following PEM enthusiastically, they will be sharing their cases which they are solving by PEM. So, this is just an endeavor to start and motivate each other. So, over to you, Dr. Shravanthi.
Yes, thank you, ma'am. So, yes, I am Dr. Sravanthi, and I probably need to introduce myself a little bit. So, I live and practice in Switzerland. I have graduated from JSPS Government Homeo Medical College from Hyderabad, Telangana, in 2002. And then after that, I did double post graduation, both in Melbourne, Australia, both with full scholarship. One was in nutritional and environmental medicine, and the second was in health services management. I also grew up in yoga. So for me, the endeavor had always been to integrate everything and practice like an integrated method of medical practice. So for me, the guiding principle has always been the first aphorism, where the most important to us is to cure. So, method, it doesn't matter which method. So, in that endeavor, I tried to learn and familiarize myself with different kind of methods, different approaches to homeopathy, different approaches to cure. And in that process, I came across sensation method like around 4 years ago, and then into PM method like around 2 years ago. Every method has its scope, every method has its limitation, and every method has its unique features, right? But for me, PEM particularly was important because firstly for the patients where we don't get the sensation, where there are certain other limitations, we are still able to find the similiimum, find the remedy through PEM method. So that was anyway special, but it was also, for me personally, it had really helped me tremendously for my own personal growth, I believe. So it is very special to me. Today I'm going to try and try and explain a little bit about the personal evolution model, taking a real case example. So it is like trying to understand the case through PEM and trying to understand PEM through a case. So it is learning with each other. So yes, so like real illustrative case. Now, this case is of a seborrheic psoriasis patient, and I have written this case up, but I'm going to give quickly first a quick background to the whole case. Now, this patient came to me in April last year, 2025, and with the diagnosis of seborrheic psoriasis. And his complaint started with patch in his scalp, and then it spread all over his head, and then to his face, and then to the rest of his body. I think it started really very early in 2024, I think Jan of 2024, and until March of 25, he was on mainstream medication. When he decided to try something new, something different, and he was referred to me, and then he came to me. The case took around 1 hour, 10 minutes, and this case was taken online. He's a patient from India, and it was in mostly Telugu language. Now, I have written up a transcript of this case, translated it into English. Able to translate it verbatim because then it would be too long, but I tried my best to capture the spirit of the case. Okay, so let me read the case first. So this is a case of a 43-year-old male patient. He was married with 2 children. He still is married. So the complaint started early 2024. Yeah, this I already said. Then itching was plus, and this wakes him up at night. And this is aggravated in winter. And when he came to me, he said it was better because this patient has lived with this complaint for over a year. He's able to isolate the season when it gets worse. There is a darkening of whole skin, the entire body, the entire skin. And then the crusts from the psoriatic lesions They are formed and they are shed. And he described the sensation of these crusts as crystallized sugar syrup. I have a picture of these crusts that we can see. And then what I noticed is that when he came to the case first, when I was taking, he was wearing a cap, and he told me that he wears a cap everywhere, and he also grew a beard because to cover his face. And he also said, the wife also said that he avoided basically going outside as much as possible because people noticed and asked him what was wrong, and he didn't like it, so he avoided it. I asked him to remove his cap, show me his lesions, which he did, and that's where the case continued. Yeah, that this I already said. And then further to his complaints, there was also left inguinal scrotal hernia. It was very small, reducible, and it was asymptomatic. And then he also had multiple calculi in his gallbladder cholelithiasis. So let me show you some of the pictures that he sent. This was the first picture that he sent me. Notice how he covered up his forehead here, and he said, I asked him why, and he said the lesions were a bit too dirty. And then this was how his, back of his head looked. You see, there was a lot of hair fall. There were these patches that were like the skin is very dry, very flaky, even cracked. There patches of baldness because of hair fall, even behind his ear you can see big patches. And then the rest of the body, the patches looked like this. Some part of them was wet, some part of them was dry, but the skin was very thick, very white, and also very itchy. And these were the sheddings, these were the crusts. Like I said, he described them to be similar to crystallized sugar syrup and the hair fall. So then I proceeded with taking the case, and this is what he told me. So he said that I sustained losses in cotton business, closed 5 years ago. Because of this, my father had a stroke and was bedridden. And then he then proceeded to talk about his family and his financial issues. And before I read this, let me give you a quick summary of his family dynamic. So his extended family consisted of his parents and his two sisters and his sisters' families. Both sisters were married with two children each. He had some financial dealings with his older brother-in-law, and his younger sister, some around 32, 33 years ago, eloped and married for love, which he was never able to handle. He was never able to forgive her for that. He never spoke to his younger sister since, neither to his younger brother in law. So that was his family dynamic. That's how it was. Then he says, my sister's family, this was his older brother in law, who took almost 70 lakh rupees from me, said he will not give it back. I trusted him, and with only oral agreement, and he deceived me. He changed colors in the critical moment. My mother completely supports them. So both the sisters, even the younger sister and her family, have been accepted by the parents. And he believes that whenever there is a family dealing or family dynamic or any kind of discussion, mother and sister's family, they talk together and then come up with a common front that he needs to tackle. He says, my mother completely supports them. She still doesn't listen to me and sides with them. Usually in the world, mothers take son's side, but my mother takes daughter's side. They talk amongst themselves and decide what to do. I had to sell all my lands and assets to settle the amount. I had to restart from zero. Then he continued to talk about it, and he said, he talked about this experience. He said, I found out how people really are. I helped everyone and anyone in need. I never hesitated. But everyone abandoned me in my time of need. But life beats you around and teaches you. Now, this clues to the age of the patient. So, as you see, I'm trying to capture as much as possible the PEM concepts here. So, look at the age, what he's speaking, what he's saying, where he must be. He says, now I have learned. I trusted everyone and got deceived. Nothing of that anymore. Just my job, my family, my work. I am living within this circle. Now I'm having to do a small job just so that I can provide good education to my children. I am earning less than what I used to pay my assistant. And look at the embarrassment and humiliation. There was an undercurrent of humiliation when he said this. What I used to pay my assistant back in those days, now I am earning less than that amount. Even now, if someone invests, I can make a successful business. So there is still a bit of hope in him that he will be able to come back. Now, all these disputes had become a minus on the children. So I put them in hostels so that they can be away from all this. So he's trying to protect his children by separating them out from all these disputes in the family. All this while, when he was saying all this, he was actually scratching his body. He took a comb to his skin and was scratching his body. Okay. I asked him, how are you describe yourself as a person? And then he said, I am a straightforward person. I don't do wrong and don't tolerate wrong. So there is a lot of not me part coming up here. Just just uh, just pay attention. World likes people outwardly speak nicely, but inside are rotten. But I don't care. If I once take a decision, it is done. Either it is right or it is out. Now look at the language he's using. It is either right or is out. It's not right or wrong. It is either right or it is wrong. So he's saying I'm a very genuine person. It is important to me that people know that I am a genuine person. He says, I asked him, what exactly do you mean by this? What is a genuine person? He says, I cannot bear lies. If one says something and does something else, something on the outside and something on the inside. And I said, can you give me an example? Where exactly in the world do you see something like this? And he says, whole world is like this. Even a fruit vendor shows you a good apple and sells you a bad apple. So everyone is something else on the outside and something else on the inside. Then he went on again to describe what happened back when he felt he was deceived this way. He said, I had a lot of mental tension. I brought rice, washed it, cooked it, and just when it was ready to be eaten, it was snatched from me. So look, he's very giving very powerful images now. I did everything, managed everything from so many directions, but they treated me like a prostitute, used me like an ATM card, and tossed me aside. And who is they here? It is the parents and the sisters, because he believes that they used up his money. He worked for them in the end, and they used it, and then they tossed him aside. He says, I feel very angry. I got very depressed and seriously contemplated suicide twice. And then he says, but then I motivated myself to stay positive. I started watching devotional TV channels, listening to spiritual teachers' sermons, reading Bhagavad Gita, watching Mahabharat. And this changed my life. And I asked him, how did it exactly change your life? How did it exactly impact you? And he says, I think of the Karma Siddhanta. Karma Siddhanta is where you're talking, where it is Siddhanta, where it guides you about your duty, the responsibility that you have towards your life, towards your relations, towards your job, everything. Now he says, I should just leave them go their own way and I should go on my own way. Who is them? Again, he's talking about the parents and sisters. I should do my duty and nothing more. Good or bad, they gave birth to me, the parents. Now, once a week, I go to their house and make sure they have all the medicines they need. And this is the point where he started crying, and he actually cried very earnestly for almost 3 to 4 minutes. So this is the deepest point in his, in his emotional experience, and it is very important when we analyze the case at a later point. So please take a note of this. He then says, I even invited them to a function at my home last month and gave them gifts, that is to his family, his parents and his sisters. My father had an accident 15 days ago. I brought them to my home and took care of them. Okay. Now, at this point, he started scratching and lost the comb. Now, when we're taking the case, there is always a question, always a doubt about where exactly the patient is talking from sensation level, where is he entering the deeper level of his experiences. Now, what happens, and it doesn't happen in every patient or not that perceptibly, but usually there is generally a shift in energy that I notice. Now, this shift in energy is not very, very gross. It is very subtle and it happens differently in different patients. In this particular patient, what happened is that this is where his energy shifted. Very subtly, he sat up a little straighter. His face was more focused to the camera. His eyes were a little more alert. His gaze were a little more focused. And when he said, while he was speaking now, the next part, there was an undercurrent of pride. So let us see what he said here. He says, sometimes I remember olden days. I was so brave, active, and energetic then. See the a clue to the inner age. Now I don't feel so active. Body is low in energy. How was I then and how am I now? Sometimes I wonder if that was really me who was that. Back then, I used to get provoked easily. All this is very much source language. I actually used to kick and punch people in business. You don't know, doctor. This is how things work in villages. See how in beginning he said not me part where he said I'm not going to, I don't tolerate wrong. I don't do anything. Now you see when he's in deeper levels of his experience, what is he saying? He says, you punch first and talk later. If you don't punch them, then they will punch you. You should always be one step ahead in business dealings. I used to make things happen even by breaking rules. So, where did all that good me part go? Where he was saying, I don't tell lies, I don't, you know, uh, don't deceive anyone or anything, don't do anything wrong. But here, with an undercurrent of pride, he's saying, I used to make things happen even by breaking rules. So I asked him, please tell me, give me an example so I can understand this better. So then he gave me an example of something from his business where he had to go and convince a convince a government official to sign something, I guess. And he said, how do you deal with a situation like this? Is that first we ask him nicely, then we ask him firmly, then we treat him to alcohol and money like we can treat him to bribery. And if it is still not working, then we see if his boss has any vulnerability, and maybe we can enter through the boss. So he's saying Sam Dan Bhed Dandopai, meaning to say hook or crook, one way or the other, we will have to make things happen. So he is saying in one way or the other, I would do to him what I need to do, quickly and quietly come back. So this is all source language. And he says, I would show him my capability. See very clearly how he's saying, how he's showing very clear me, very clear you, and a very clear verses in between. So he knows very clearly who the enemy is and what he needs to do to them. Right? And then he said, I had made back then business my whole life and didn't even have any friends. It was all about business, not anymore. I even changed my phone number. Now I even changed my phone number now to lose all those contacts. So reading in between the lines, right? Why would someone change a phone number? Is it because you want to lose their contacts, or is it because you want them to lose your contact, right? If it's really to for you to lose their contacts, there are other ways to do it, right? So then he says, after watching Mahabharat, I am a different person. And I said, in Mahabharat, then what is the character that affected you the most? And he says, my ideal is Vidhur, how ethical he is and how much he stays within dharma. Now I am much calmer. I think before acting. Sorry. I tell myself, take it easy and leave. I don't get provoked. Now I live within my boundary. All this is source language. Other than those 8 people, which he's talking about his 2 sisters and their children, since they are the reason for my life being this way, I can forgive anyone now. So, and then he says, my only aim now is that my children should study well and settle well. We are OCs. Now, OCs in India is the other categories. Meaning to say, in India, if you're born within certain sects, certain castes, there is a preference in educational institution, in jobs, etc. Anyone who is not within this preferential caste, they are called other castes or other categories. So they don't have any reservations. So he's saying we are OCs, so we have no reservations. We need to work harder than others. And he says, when I asked him, what is the advice that you would give to your son? And he says, be nice, just do your work. Don't interfere in anything outside your boundary. World is like this. Don't get deceived. Be alert always. Don't trust anyone. So this is all clue to his inner age. Okay. When I asked him, sorry, I showed him woman one and asked him to contemplate on this and tell me what. Don't think logically what the image is trying to tell you. Tell me what comes first in your mind. And he says this picture is scary because it looks like a ghost. And I said, okay, it did not come straight. I had to ask him in a couple of ways, 2 3 ways, to extract this thing. I basically asked him, how exactly would he experience when he sees a ghost, when he is scared? And he says that there is if someone sees the ghost, there is shaking in in their heart. For a microsecond, they can't move, and breath gets stuck in their chest. This is all source language. Okay. And I asked him further, I investigated further. I asked him, when does one get scared? And he says, one gets scared only when they do something wrong. Sincerity, punctuality should never give anyone chance to say anything bad about them. If they really did something wrong, then they would have to agree with the other person, and that would mean surrender. So surrendering is the last resort for them. That is, so if you do something wrong, you'll have to surrender, and surrendering is the last resort, and you don't want to get to that point, right? So that's why don't do anything wrong. That shows that they are incapable. If you're surrendered, that means you are incapable. Surrendering happens only when there is no other possible way. And he says, and I asked him, what is wrong? What is right? And he said, wrong is something that is not genuine. Fraud, no ethics, no loyalty. What is the opposite of it? Is selflessness, transparency, no changing of colors. You see from any direction, right or left, head or tail, it is only white. It is natural. That is all source language. Now, I asked him what exactly does boundary means, because we use some words like boundaries, boundary, circle, limits, all that. So I asked him what that exactly means, and he says, your ethics, values, and respect. Outside the boundary is quarrels, disputes. Inside is safety. If we cross our boundary, we will be vulnerable. So that was the case. Okay, so now let us look at PEM perspective of this analysis. And I know many of you must probably already have worked this case out. And like I said, there are many ways to approach, especially this case. The patient gave a lot of good information, and we could have approached this case in other ways as well. But I have approached this using PEM method. And so let us see how we can do it, how we can approach this case through PEM analysis. And before anything, let us first determine the kingdom of the patient. And this patient gave very clear kingdom sensations, right? He said there was very clear me and very clear you. I even highlighted the example while reading the case. There was very clear me versus you in this patient. Also, the other clue is that this patient gave many sensations, many complicated sensations. It was not a simple positive and then the negative sensation that we see in some of the other kingdoms. So in this patient, also the clue was that there were many sensations. So I had determined this patient's kingdom, to be animal. So any questions? Anybody has any other ideas about the kingdom? I mean, was I not clear? I think it was quite clear, right? That this was an animal case with me versus you um, issues. Okay. So let me go ahead now with the PM analysis, right? Now, before we go into the PM analysis and PM approach, let me quickly give a short and a quick introduction of how PM works. Now we know the cardinal principles in homeopathy. One of the main cardinal principle is like cures like. Now with PM method, it is not really all that different. In like cures like, there is something in the patient that is similar to the same thing in the remedy, and through that, we find the similiimum. In the same way, it is really the same way in PEM, Personal Evolution Model. What are we trying to do? Something that is similar in the patient, something that is in the patient that is similar to something that is in the remedy. In Personal Evolution Model, what is that something? Is in general, they call the evolutionary stage. Meaning to say, the evolutionary stage of the patient is compared to a bunch of remedies in nature that have same evolutionary stage. And then in that bunch of remedies, we will find the similiimum. We will find our similiimum to our patient. How is this done? Let me illustrate this using a map or a chart. In personal evolution model, we get given, there have been developed a lot of charts, and to do exactly that, to understand, to guide us to the evolutionary stage of the patient, of the asset. Okay. Now I brought this, and we have different charts for different kingdoms, at least one for each kingdom. And I have brought this chart, which is the animal kingdom chart. And the mainly reason because we are trying to understand PEM with the help of this particular patient. And this patient we have determined was the animal kingdom patient. So this chart you see immediately, there are two main blocks in this chart. There is one block in the top part and the another part in the bottom part, one which are more or less identical to each other. The top part is given for invertebrates and the bottom is for vertebrates. And the rest of the layout of the chart is more or less the same, more or less identical. So let us first determine if this patient we have determined is an animal kingdom. Let us determine if it is an invertebrate or a vertebrate, and then we can then blow out the chart which he belongs to, and then analyze more personalized to our patient here. Okay. Now, how do we say what is the quality of invertebrate and the vertebrate? How do we differentiate them? Now, what happens in invertebrates? Now, all animals always, all of them have me versus you issues. There is no doubt about it. But when it comes to invertebrates, what happens with the you? Me is clear. What happens with the you is that it's not as clear as it is when it is for the vertebrates. Meaning to say, the invertebrates are not clear about who is the person, who is it that we are, or what is it that we are up against, what is the enemy, what is the you. As opposed to when it comes to vertebrates, the you is very clear here. um, so who is the enemy? Who is the one that we are up against? Who are we trying to survive against? That is very clear in vertebrates as compared to invertebrates. Like we see exactly in this patient. What did this patient say? He said, he was very clear about this person, the government official that he very knew who his target is. He needed to basically make this person sign that paper, and how does he need to do it by hook or crook. You do this, that, the other. If not, come through the his manager, do one thing or the other very clearly who the enemy is. And at the other place, the patient also actually counted the number of people that are responsible for his life to become the way it is right now. So this patient was clearly a vertebrate. Now, being a vertebrate, now let us blow up the chart of vertebrates here, okay? Now, this is how the chart looks in general. Let us look at the chart very quickly. And what do we see here? The top part, the darker blue parts here on the top, and to the far left here are um, the categorization criteria for each chart. Okay. Now, when you at first glance, when we look at it, it is filled with different words that are seemingly unconnected with each other, but they are not really. The chart here is filled with, especially the categorization criteria is filled with words that seem very, very simple, but how do we make sense? How do we make meaningful reading through this chart, right? Now, every single word, on the contrary, actually, that have been put on this chart is done for very, very strong reason, very strong logical reason. There is a strong method to this madness, how it has been arranged and organized here. It is almost like in our olden days, we used to have these telegram letters, right? Where there used to be very simple words used, but it was punch packed with lot of meaning. In the same way, all these words that we see here, which are seemingly very simple, behind the scenes are punch packed with a lot of knowledge and wisdom and observation into the nature, into human personality, right? So this seemingly two-dimensional, very simple, innocent-looking chart behind the scenes has a lot of things going on, right? So how do we read this very, again, like I said, two-dimensional chart? Let us look at how the layout is. Basically, from left to right, we have columns in this chart, and from top to bottom, we have rows. It is very similar to an Excel file that we work with, right? We have columns and we have rows, and where we have the convergence of column and row, we have a single cell or a little box where that is formed. Now, what do columns depict? Left to right, they depict evolution of the asset. And then what do the rows depict? They depict the development of the asset. Now, what does evolution mean? How do we understand? And again, where there is this convergent point between this evolution and development is where we find the evolutionary stage. And the evolutionary stage, why? It is where we will find our similiimum. That is the basic principle of personal evolution model. Now, so what does it mean? It means that we need to understand the evolution of the patient and the development of patient and then match it with the chart that have been given here. Okay. Now, how do we determine the evolution of the patient? Now, evolution of the patient basically depicts the how much the level of individuation the patient has from the source. Now, there will be some words thrown. We can't help it. They look very fancy words, but we can't help it because the principle behind all this is going to people like and the psychological models like Carl Jung's model. So we can't really help using these kind of words, but there is really no need to get intimidated by these because we get a lot of help. There is a lot of guidance available to understand how to determine the level of individuation, right? We can understand it by understanding the level of ego development, how well the ego is developed in this patient, how much is the patient's awareness of this world, right? Where do patients' issues lie? Where exactly which level the patient's core issues are. Where is the patient's energy? How is his natural energy, dominant energy, right? So there are many things. And it is not, although it seems different to each other, it really is not. They all come as a package. Like, for example, if you take a tree, let us take a banyan tree, a people tree, okay? It all comes with a package, as a package, right? All the qualities come as a package to it. So, for example, a banyan tree has a specific quality of the bark to it, and also how big the bark, how big the stem grows, how big the tree grows, how is the growth year by year, how is the leaf, what is the shape of the leaf, what is the color of the leaf. Now, if you are able to see only the leaf, we will still be able to track it back to saying that this is a banyan tree. Now, the leaf doesn't look anything like the bark, but we know that it comes in package, right? It all comes together. So what does it mean? That even if we are not able to understand the whole package, depending on what the patient gives. If the patient gives only a part of it, personal evolution model and the help that we have, we will be able to understand and determine the level of individuation of the patient, meaning to say, we will be able to determine the level which column the patient belongs. Right? So there is a lot of help that get given. That is what we see in the categorization criteria up here that we talked about in this chart. Okay. Now, for example, in this patient, like I said, because there are many ways to approach to understand the column, in this patient, I felt that the best way to approach is by understanding where his energy lies. Okay, is it masculine or feminine energy? Now, for that, we go to the concepts of Taoist philosophy, Taoism. Now, like I said, there is a lot because, this simple looking chart, there is a lot going on behind. This is one of those things. So, Taoism philosophy basically helps us understand where the person's energy is dominant. Now, I say dominant because, again, a very simple, a very clear disclaimer here is that no person in this world, not single one of us, is born with only single kind of energy. We are all born with both energies, masculine and feminine. All we are trying to do here is to determine which energy we are dominant in. And let us see, how do we determine it? By looking at the qualities of each kind of energy. Now, feminine energy we know is yin, masculine is yang. Feminine allows, masculine does. Feminine accepts, masculine acts. Feminine gives form. You know what we call Prakriti? That is feminine. And masculine gives energy, what we call Purush. Feminine is the being, and the masculine is the doer. Sorry. Now, how do we do? How do we then ascertain the dominant energy in this patient? It is again very clear, right? There is a lot of masculine energy in this patient. He wants to act, he wants to do. There is a lot of will in this patient. It is, if you're looking at it from chakra perspective, this is a very good case of chakra 3, C3, the Manipura chakra. Okay. Now, in the chart also, we will see the farther we are individuated, farther we are from the source, we go from left to right. That is how the chart is placed. From left, if we are looking at it from elemental perspective, we get the water element. And if we go to the right, we get the fire element. And this patient is very dominant in the masculine energy in the fire element. Is that okay? I mean, do you have any other perspective to this? Do you want to say anything? If not, we continue. So let's bring back the chart, okay? Now from here again, because I said there is everything comes with a package, right? The column, it comes with a package of qualities. It comes with the individuation level, comes with a package of qualities. However, because I promised that there is a lot of help available already in this chart, let us look, let us see how we can come to the evolutionary stage and the remedy by using mainly this chart. Now let us look, we have determined that the dominant energy in this patient is the fire energy. And where do we see fire energy dominant in this chart? We see it in two columns. One is column 3 and one is column 5. And I am able to, and I can count, this is considered column 5, not 6. Okay. Now, what is the difference between the fire energy in column 3 and column 6? Many differences. However, because we're looking at the chart, let us see how we can differentiate just from here. What is column 3? It is representing the womb stage, and column 5 is representing infancy and childhood stage. Just from the chart, what is the survival strategy of womb stage? It is to hide. And what is the survival strategy of infancy and childhood, or the mammals in this case? It is where in column 5, it is the strategy that we adapt when there is short supply of forage. Okay. Now, in this case, it was very clear that the patient is adapting the strategy of hiding. right? From the beginning, it was all hide, hide, hide for this patient. And there is a reason why this patient was hiding, and that we will know once we understand the source of this case. Okay, so then we determine that this patient is belonging to column 3. I also said that this patient is dominant. It is the imbalance of C3 that we see in this patient. We know that even in developmentally, the patient's issues, ego development, this patient is showing very clearly the toddler stage of development when it comes to column. Like I said, more than one way to get to the column. Okay, so that is the important, that is the good thing about doing this through personal evolution model, because we will be able to check ourselves, right? Now, just because the patient is showing fire energy, does it mean that he needs to be in column 3? Not necessarily. Then we look at other qualities of column 3 and check ourselves if we are analyzing, if our analysis is in the right path or not. Now let us do the same thing. Now the chart is saying the column 3 is with reptiles. Okay, here like the reptiles, this is the same evolutionary or individuation point of reptiles. Let us double check if that is the case. I entered the column actually through sensation, because the patient was very clearly giving the sensation of one-upmanship, which is identifying factor for reptiles, right? There is this unfortunate feeling. We are born in OC category, so we don't have reservations. We are at a disadvantage. There is a lot of malice towards who he feel has wronged him. There is a lot of mistrust. That is also the advice that he would give to his son. There is also this concept of not me, where he was talking a lot about these changing colors, this concept of deception, this whole concept of camouflage that we can attribute it to. And then there is, he very clearly said, I do my thing and come back quietly. Now, this we see in many animals, not just in reptiles, but in coordination with the other qualities, we can say this is a reptile quality in this patient. Okay. Now, moving ahead, the column we have determined. Now, to get to the evolutionary stage, we need to now determine also the row. And the row basically is the developmental age. And in order to understand the developmental age, we look at some of the some of the clues. The patient has given some clues here. I have pointed it out when I was reading the case, but let us look at them again. What was he saying? How was I then, and how am I now? It's not a child who would say, who would reflect back, right? If you are having to reflect, if you are reflecting on something, you probably would have had to have reached a certain amount of mature age. Now he's saying body is not so active anymore. I was very active back then, but not anymore. He says life beats you around and teaches you. And in during the case taking, the natural progression from the doctor was to ask what his life advice to his son would be. And why would the doctor ask? Because of the clues that he was like, the natural energy was flowing towards older age. Otherwise, only older people can look back and give advice to children or to younger generation, right? And then he's saying his ideal character in Mahabharata is Vidhur. Now, no child is going to watch Mahabharata, read Mahabharata, and say that my ideal character is Vidhur. Now, those people who don't know who Vidhur is the minister in Kuru dynasty. It is one of the epic. Mahabharata is one of the epic in Hinduism. And Vidhur is one of the characters who is kind of very, very strong with balanced decisions, very, very much into dharma, the duty, the responsibility, morality, all that kind of thing. And then he was also talking about settling his children, how all that. So it is definitely he's towards the older age, right? Now, with this clue, let us bring up the chart of Erik Erikson's. No, so in personal evolution model, in order to understand the row, we take help of Erik Erikson's chart. Now, 8 of these stages have been given by Erikson himself. The first one, the womb stage, has been added by Gandhi sir. Now, We will not go through and every stage has its symptoms or its marks of being successful at that age, and marks of being, if the patient or if the person is has a failed stage, failed that particular stage. Now, we will not look into all of these stages because we don't have time, but we have an indication that this patient is towards the old, mature adulthood, old age. So let us look at more focused on the mature adulthood and old age. Now, what happens in mature adulthood? If you are successful, you are into productivity. If you are a failed, if you have failed in mature adulthood, you are into stagnation. In old age, so productivity, that is seen as care, and stagnation, that is seen as being not purposeful, feeling unpurposeful. Now, next is old age. Now, old age, the successful phase, is seen as wisdom, seen in wisdom, and failure is seen in despair. Okay. Now, this patient very clearly was in care. There was regret, but
Hello,
this,
Dr. Shravanthi. Just a
yeah,
minute. Sorry to disturb you. You just stop sharing and share again because there is some scribbling on the
okay,
screen, which is to just stop sharing and share it again. So the scribbling will go.
okay, okay, ma'am.
Yeah.
Can you see it, ma'am?
Yeah,
Yes,
perfect.
ma'am.
Yes, ma'am. Yeah,
It's
it's
good?
perfect now.
Okay.
Sorry for the disturbance, but now you can
No,
continue.
no problem.
Yeah.
Okay. Okay. So in this patient, yes, we see regret, but the regret that we see in old age is different. It is more towards, because it brings despair in old age. When you regret it, you're mostly thinking, um, why did I not do that? I should have done it this way, not that way. So that's the kind of reflection that leads to despair, where you lose your ego integrity, right? So that is the old age. So this patient was clearly more towards care. We have seen more than one place where he was talking about his family, how he takes care, and how he is. Now, in personal evolution model, we are of course taking help of Erik Erikson's model, but quite frankly, if this could have been done well in chakra method, if because in chakra method there is a finer differentiation. Just think about it, right? Like mature adulthood is not just simply mature adulthood where we just get into productivity or stagnation. First, what happens in mature adulthood? Whatever career that we have started as a young adult, we bring it up to pinnacle, we bring it up to the most success, and then we try to maintain that success, make sure all your family, all your responsibilities are taken care of. You have something, you have some kind of safety net for yourself and for your children, for your family, for everyone that you're responsible for. And then you start to take care of, maybe you expand your care horizon, take care, maybe you think about, okay, for myself as well, maybe I can focus on my hobbies now, something to make me happy now, or take care of the society, what can I give the society back, all that. So this patient would have been in C4B, very clear C4B, but we are not doing chakra method in this one. It's only retrospective analysis. We definitely determine, when we are looking at the Erikson's model, we definitely determine that this patient is belonging to mature adulthood. So we have been given very clear clues by him. Right? So taking this into consideration, let us again go back to our chart and see where he fits in, right? So we have determined that this patient belongs to column 3 with fire element, and in in the rows, I have here circled both adult and old age. The reason being, if you see what we are coming to the evolutionary stage, we have Elapidae and Crotalidae, both snake families. Now, what happens particularly when it comes to Elapidae and Crotalidae, is that there can always be a mix and match. There can be a crotallate that show dominantly features of old age, but also adult. adulthood. The same thing can happen with Elapidae. So when we are looking at this box, we tread a little carefully, right? So our evolutionary stage, the patient, what we have determined now, is in the same evolutionary stage as of elapids or crotalids. Okay. So now let us look at more carefully, more details so we can get to our simillimum. What are elapids? What are crotalids? Now, these are some pictures of elapids I put here. Now, elapids are our coral snakes, our cobras, our kraits, and crotalids are our rattlesnakes. And we also put our vipers here. Okay. Now, I have put here the box small differentiation, like a summarization of differentiation between elapids and crotalids. And now let us use this box to understand where this patient more belongs to, where this patient is more similar to. Okay. Now, elapids are less evolved. When I say less evolved, that means basically less evolved than crotalids. Now, elapids cannot control their venom. They have this, like their lower jaw is rigid. They can't control their venom as opposed to crotalids who can. Now, elapids attack when triggered. This concept of trigger, this concept of provocation comes very much frequently in elapid cases, like what we saw in this patient. Now, he said in more than two places, he said, I don't want to be triggered. I don't want to be provoked. I feel provoked. They provoke me. And then I hide myself. So I'm trying myself now. So I am not provoked. So this is the sensation of an elapid. Now, forget if the patient is actually provoked or not. So if you're looking at it from the outside, you may not feel many times that the patient is provoked. But what is important here is the sensation of the patient. Is he feeling provoked or not, which this patient was? The next thing is elapidae. Most of elapids are neurotoxic. Not all of them, yes, but in general. Crotalids, hemotoxic. Okay, so then when the patient said what happens to him, when what happens, what might happen to one when they see a ghost, this is the source language. He gave exactly what would happen when there is a neurotoxic snake bite. Now, elapids, they attack singly. Now, here, how we see this in patients mainly is when he is feeling singled from a group. Now, this shouldn't be confused between me versus the group, but it is more like how this patient is saying, uh, they talk amongst themselves, the family, the sisters, and my mother. They speak amongst themselves, and they talk to me. They come with a united front, and I am up against them. So I am one against them. So this is how their sensations show. Now, this is an elapid, and I have always been very curious if there is a certain amount of doctrine of signature in the patients when it comes to snake patients, like elapids and crotalids. I recently gave hemasciatus for one of my patients, and he's an elapid, but then his strategies involved friends, involved other people, other friends as well. But then Hemasciatus is the only snake which is in company decides for friends. So I'm very curious about this because, when you're strategizing, do you do it singly or do you strategize using a group of friends? Like how we see in the movie Ocean's 11, there is a group of people that involve in the plan, right? So if you have cases, snake cases, where you see any doctrine of signature here, please let us know. It will be very interesting to see that. Now, elapids are more timid, they are shy. Crotalids are more outgoing. Elapids are not so loquacious because they are shy as opposed to crotalids. Elapids, the theme of humiliation comes again and again. Like in this patient, it was very clear when he said in a few more than one place, he said, I earn less than what I used to give them. Even if now someone invests, I can show, I can do it again. So then elapids are also slower, they are lesser evolved in that sense than crotalids. Elapids in general are chilly. There are exceptions, but in general are chilly compared to crotalids, which this patient was, this patient was chilly. He had very clear aggravation during winter. Okay, so because then this patient looks like he's an elapid. Now, I'll have to be very honest with you. I did consider Crotalus horridus for this patient because it was a very clear theme of, look how well I take care of my family, which is what we see very clearly is a seductive technique of uh, each snake has their own seductive technique, and for Crotalus horridus, it is look how well I take care of my family. However, that is the importance of personal evolution model analysis is that when we look at it this way, then it becomes very clear, right? Because every snake, for example, if we know that it is a snake, every snake shows the characters of some other snake. It is not like in a diluted manner or in a concentrated manner, but there is only one similiimum. So this is how the personal evolution model helps us get closer and closer to the remedy and then isolate it. Now, because this patient now looks like he is probably an elapid, let us look at his whole theme of camouflage. He talked about it in Not Me, the deception part, everything, right? So let us look at how elapids camouflage. Now there are two ways of camouflage. So you look at this snake which is almost blending in with its surrounding. This is called cryptic. And you see our very own friend Elapse here, who is like not at all trying to blend with the background. He's actually doing opposite of trying to blend in. Now, where they are trying to blend in with the atmosphere, these two are the main ways of camouflaging or main ways of coloration in elapid group of snakes. The snakes that try to blend in are called cryptic camouflage, and the snakes that don't try at all are trying to adapt aposematic strategy. Now, what does why do they do that? The cryptic kind, they are trying to basically hide. Okay, they are hiding because their strategy is to ambush. You will have no idea where they came from. However, the aposematic type, it is really their strategy is by intimidation. Sorry, intimidation or avoidance, meaning to say they are declaring to the world that I am poisonous, hands off, don't come near me. Okay, so that is also the reason why these snakes are called coral snakes because they are so brightly colored. Okay, now when you are able to blend in with the surroundings, you will be able to ambush your enemy. So your enemy will not have any clue. However, when you are not blending in, basically the enemy gets a warning. And that is basically what these coral snakes want also. They don't want to bite you. That is not their first go to anyway. They want you to be warned and leave them alone. Now, these cryptic snakes, they are usually found in low light nocturnal habitats, and these aposematic are more the diurnal kind of snakes. Okay, now just because I talked about this in this particular case in this way, it doesn't necessarily is. See, when it comes to the sensation of the source, right? Now, this is the sensation of the source, what he gave, right? What he gave about the coloration, the not me part, everything. It doesn't necessarily mean that patient is saying, I am genuine. Look at me from right, left, up, down, anywhere, I'm only white. So basically, he's saying he's not changing colors. Now, that can indicate if it is this kind of snake or this kind of snake, but not always. Because the patients, they can give you in the same exact words the sensation or compensation. So here we need to, when we are looking at it from this perspective, we need to be careful how much we take that into belonging to the patient himself. Okay. In this case, however, he does look like he's a cryptic kind of. So he's talking all the time about being in the same color, no differentiation. You look at any direction, it is it is the same, no change. Okay. Now, let us then summarize everything that the patient has given and try to get to the remedy. There is a very strong theme of trigger or provocation. There is a theme of one versus the group, where he's saying he's feeling that he's singled out, he's single, and he's having to face a group. There is a theme of humiliation. There is very strong theme of hiding. And there is a theme of the neurotoxic venom. He said things like there is shaking in heart. You can't move. The patient was projecting here. Basically, he was saying what would happen to one when they are suddenly scared, when they're exposed to a ghost completely unexpectedly. He said, you can't move, and breath gets stuck in the chest. There is parental care in this patient. And this patient is chilly. Patient is also left-sided, but I did not put it here because I would not have eliminated the remedy just because it is left-sided. However, the most important individualizing for this patient was that he had a very strong wrong suffered feeling, strong antagonism with self, contradiction of will, but morality, responsibility, and duty, as strong as they were in this patient, they were in conflict with him being wrong suffered. This feeling of wrong suffered and wanting to be malicious towards the same person that he feels duty towards, he said very clearly, this is the point where he cried so earnestly. He said, I bring them, I take care of them because this is my duty. But what is he feeling? He's feeling so malicious against them, but still he's in such an antagonism with himself. He feels that he needs to do this because it is his duty, but at the same time, what he really wants to do is to do some harm to that same person. So this thing then, when it's seen, it is seen only in our very own King Cobra Naja, right? Now let us look at the rubrics, some of the rubrics, if they support the analysis or not. Now, the rubrics that I have taken here, I try to make it as individualizing to this patient as possible to the extent that rubrics can. So this kind of thing where something comes together with the other thing is something that we need to take away from it, from the analysis part of the rubric rubric understanding. We don't get directly that this symptom is in conflict with the other symptom, right? So you see here, I've taken wrong suffered, antagonism with self, loss of financial. It is not a psoriatic symptom that his whole skin becomes dark. It is more individualizing to this patient. It is not a disease ultimate, right? Now, what do we get here? We get Naja and we get lachesis. And lachesis, in fact, outperforms Naja in this, in marking. One thing I have to say that loss of financial loss, aggravation, we have another species of Naja. This one is Naja tripudians, but there is another species of Naja, Naja pallida, which is covered in this rubric. However, if lachesis is covering more than Naja, I would still go for Naja in this case. Why? Because of exactly the analysis that we have done. How PM tells me that Naja is an elapid which is more towards mature adult, which is what this patient is showing, right? And then one thing is that Shankaran sir, he says that if you get lachesis in your repertory chart, don't exclude all the other snakes because lachesis has been so stellarly proven by Dr. Herring and documented that if there is a symptom that is covered in lachesis, we can consider it as a common symptom or it can be considered maybe present in other snakes as well. Okay. And the other thing is that what is interesting to me is that both lachesis and Naja are, although all snakes are very, from chakra perspective, all snakes are very C6, C5, C3. Lachesis and Naja are good examples of C4, and they come side by side here. So this repertory sheet is really, it's a lot of very interesting on many levels to me. Okay, so yes, I went with Naja tripudians with this patient. I started with Q3, and the patient I have just started him on Q9. And I will show you some follow-up pictures. This is how he looked in the beginning. It was his first picture. And then I put this one is almost towards the end of Q5. And I actually have quite a few pictures of this patient. But the reason why I selected this particular phase of his recovery is because this is a point where the patient stopped talking about Vidur, stopped talking about morality, stopped talking about duty. So something must have, at least that shift percolated to me only at the point of Q5. Okay, and this is also the point where I gave him an intercurrent tuberculinum, 1 dose of 10 Okay. And after this, what I noticed is that his recovery was even faster. Now, this is how he looked recently. And this is in general how all his lesions went all over his skin. It is really just the discoloration, the mark of what it was, what the lesion, where the lesion was once. Okay. Now, this is how his scalp was. And this is in that middle part where you can see the hair is returning, and we can see the hairline again here. The skin is getting better. The dryness, the cracking of the skin has gotten better. Now this was until last week. I mean, this was the picture until last week, and just day before yesterday, Saturday, I got his latest picture, which looked like this. So there were some lesions still here, but here you see even those lesions are slowly disappearing. Now this rest of his skin is something like this, like I said. Okay, so that was my case. And do you have any questions?
Yeah, wonderful case, Dr. Shravanthi. Do you have any queries? So just post the queries in the group to see how beautifully this case was presented. It was a case of a reptile. Yeah, Dr. Shravanthi, there is a question. Why tuberculinum tenem?
So for me, tuberculinum, it is my go-to remedy when there is any skin disorder, chronic skin disorder, or a respiratory disorder. But then later, I got this confirmed because this patient, from through Chetra method, right? This patient, when you look at him, there is a lot of wrong suffered, which is C5, strongly. And there is a sense of disconnect. He's not able to communicate. That sense of disconnect between him and his family is ending up in making him feel wrong suffered. Lot of theme of deception, the lies, all that is coming together. And C5 um, is dominant in tubercular miasm. So although I did not do it through chakra system, it was only like, post analysis. I found that probably is the reason why also that tuberculinum helped him tremendously.
Yeah. So there is one more question. What is Q potency? Is it LM potency? You can stop sharing, Dr. Shravanthi, so that we can see you.
Okay.
What is Q potency? Is it LM potency by Dr. Tushna?
Okay, so yes, Q potency is LM potency. Now, the reason why so LM potency is not technically the right name because LM is the Roman numeral, right? L is considered 50 and M is considered 1000. And when it was written, we write L after M, meaning to say 50,000. However, Roman numeral system do not work as Dewey Decimal System work. Meaning to say, if you write one number after the other, it's not always addition. So LM in Roman numeral representation is 1000 minus 50. So LM means 950. So that is the reason why it has been renamed to Q potency, which basically is, I think in Latin, it is like quinquagentamilia. Yes, I think it is Quinca Gentamilia. And that basically means exactly writing 50,000 and representing it with the first letter of 50,000. So there is absolutely no confusion.
Right. And there's a question from Dr. Vijay, how exactly you differentiated between legacies and Naja, even when Naja was carrying less marks in repetization.
Yes. So again, the whole development of analysis, we know that the patient showed more qualities of elapid. The patient was definitely more towards mature adulthood. He was more in care, less in regret, right? And so that basically means it's probably an elapid. Naja is an elapid, lachesis is a crotalid. That is the importance of personal evolution model, because when you if you are trying to handle this only with sensation method, for example, we don't get this kind of guidance, right? So this guidance of rows, determination of ages is something that we get supported from personal evolution model.
Now, there's one more question. How do you explain the boundary word used in the case explained with Naja? The word
So
boundary it was used.
yes. So this was the sensation of womb stage. Now, I showed you that the fire element is seen in column 3 and column 5, and there was a reason why we went to column 3. There was more than one reason. Like I said, each column is a package of more than one quality. Womb stage usually shows when a patient says things like inside, outside, boundary, limits, circle. He used all these words. Then we are pointed towards womb stage. Now, here's the thing. Usually, womb stage third column, we also get the sensation of suffocation, which this patient did not give. This was the missing piece. From sensation analysis, from me, I was not able to extract this from the patient. However, still I was very confident that this patient belonged to column 3 because I got everything else, especially from the personal evolution model.
And there's a question from Dr. Leisha. You pinpointed about patient crying, how to interpret it.
So this was the deepest. So basically, the patient was crying. It was on emotional level, on superficially when we look at it. However, when you look at it, where is the patient exactly crying? And he didn't just cry; he cried earnestly for like 3, 4, maybe even 5 minutes. He cried. This was the deepest point of his experience. He was like at conflict with himself that he is doing this because it is his duty to the same person that had harmed him. He is having such a strong wrong suffered feeling, malicious intent, want actually to hurt this person, but because it is his duty, he is taking care of him. So that is his deepest conflict. This is where he is antagonistic. This is where we see the antagonism of Naja.
Right. Uh, there's a question from Dr. Kushbu. When prescribing snake remedies, how often do we repeat the doses?
It is not, it depends really on the potency. I usually go by Q potency. So for me, repetition is not a problem. It is only really upping the potency that I think about. Um, for me, it doesn't matter if it is a snake remedy or any other remedy. It depends. You can the general rules are the same. We look at Kent's 12 observations. Where do we repeat? Where do we wait? Where do we stay? So yeah, as long as if you're going with a snake remedy or any poisonous remedy, don't go too low. That would be my advice.
So thank you, Dr. Shravanthi, for such beautiful explanation. And what I liked about your case was I just have noted some points. And I want to share with everybody what we have this experience of reptiles. So whenever you take a case of reptile, because there is a shadow which is very intense, so that shadow is being tried to, he's trying to put the shadow beneath, right? So in PEM method, we can see the clear cut. I didn't catch that. Could you try again? We clear cut can see the relationship of the pathology and the inner age. Here, what he is doing is his energy is being suppressed, his identity of who he is suppressed to a level that psoriasis has come. What is skin? Skin is also boundaries. So he was talking about boundaries. And here what he is doing is he's suppressing everything so below his shadow that his identity which is affected, it's seen as psoriasis. So most of the leprosyphilic remedies will present as cases of psoriasis. Right, Dr. Shravanti?
Yes, and when you talk about this, ma'am, I just wanted to also highlight, and you see, particularly in this evolutionary stage, we have fire element in the column, fire element in the row. What is our more egocentric personality trait is the one that we are trying to suppress so rigorously. That is
Yeah.
where we find the antagonism. What is it that we are proud of is what we are so rigorously trying to suppress.
Right. So we can see the clear-cut relationship between the inner age and pathology, right? And also snakes, whenever you take a snake case, the snake's reptilian patient, they use this projection. Like Dr. Shravanti has very beautifully seen that I am not like this, I am not like this, I was like this. So we can see different ways of projections. So this is a very important tip in taking a reptilian case. Then we have this reflection of old age. Dr. Shravanti has beautifully shown how this old age is coming here, how this mature adulthood. Here he is reflecting who he is. So these are very fine nuances which you have to pick up in a case for seeing the inner age, right? So here he has seen that he was reflecting. I was like this before, I'm like this. So he's reflecting this idea, this pattern of reflecting, going within, understanding who is, shows a mature adult. So these are all pointers towards the inner age. Hmm? So, and also the character of Vidur, who is full of wisdom in Mahabharata. So you have to pick up your case taking also changes with PEM method. Hmm? So all this we share in our courses. We have basic and advanced course for beginners, and then we also recently we did a course on mollusk, which was very appreciated by most of the participants. And now, shortly, we'll be starting with a course of mammals, the way we have done mollusks. Also, we'll be coming, Dr. Gandhi has, we have a series of lectures by Dr. Gandhi. It is one case at a time, and he will be talking, analyzing, and he'll be showing every case with PEM concept. So, this is every alternate months. So 4th of February, we'll be coming up with this new course, which is Manthan. So we are looking forward to see you all, and thank you, Dr. Shravanti and everyone for joining this session.
Ma'am,
And
I would like to say one last thing. I would
yeah,
like to really thank you for this giving me this opportunity to present my case and also to be able to say pay my deep gratitude to Gandhi sir. So I was hoping that this was one way I could do that.
yeah, thank you so much. We have the same spirit of sharing. We all love learn from Dr. Gandhi, and we try to share it here. It is just we are here to just motivate each other and be as a community of supporting each other, right? So we are all here to take each other holding hands. Yeah. So we'll see you again in our next Pragyan session. Till then, stay tuned and please
Sorry,
IPEMA WhatsApp group. We post all our information there. Yes, Dr.
sorry.
Roland?
Yes, sorry, Dr. Mita. I would just like to see from Dr. Sravanti again the first slide after the first three or four pictures from the patient. I missed
Yeah.
this slide and I would like to have it if it's possible, if it's not too much.
Yeah, Dr. Shravanti, please try to share those initial shares. Yeah. Hi, Dr. Mukund. How are you?
Can you see my screen, Dr. Roland?
Yeah,
Yes, I can see it. Yes,
Which one are you is
just after the first three or four pictures you gave us from the patient, and then came the next slide with some explanations from the
Oh,
from
the
the
initial, the
picture.
first one,
Yeah,
very
yeah,
first.
initial
Initial,
photo.
Okay,
the very
okay,
first pictures from the patient you showed.
okay, okay, okay. Let me get
Sorry,
there.
sorry.
No, no, no problem.
So I will also request
This
all
is
of you,
just
if you
now.
have
Yes,
cases,
this
you can
one.
share it
One.
here.
Just a moment. Yes. Okay. I make it. Yes, very good. Very nice. Thank you so much.
Thank you.
Thank you.
Thank you.
Hello, Dr. Mukund. Nice to see you here after such a long
Yeah,
time. How are
thank you
you?
very much. It was really good sharing.
Yeah, good sharing. So please, we request all to share your cases here. It's a place for learning and supporting each other. And where will we access the recording? We'll put it on our YouTube channel. Hmm? So it will be there. You just go through it again. So thank you everyone. Stay tuned with IPMA WhatsApp group. We'll be posting all the information there. Bye-bye.
Thank you, everyone. Bye.
Bye.